Amidst media fear-mongering about Ebola, a very real threat lurking in this country kills 1,500 people every single day. Cancer. And 1 in 8 women will be diagnosed with breast cancer in their lifetime. So to help combat the horrific trend, October has been designated Breast Cancer Awareness Month, signified by the pink ribbon. You probably already know this, considering every giant corporation and carcinogenic product has donned itself with pink, a trend that many critics have called a pinkwashing marketing ploy that doesn't do much when it comes to combating actual cancer. So to talk more about this, I'm joined by Karuna Jagger, Executive Director of Breast Cancer Action. Thanks so much for coming on.
Thanks so much for having me.
So earlier this month, fracking company, this is probably the most absurd example, Baker Hughes partnered with the Susan G. Komen Foundation to produce pink drill bits for the cure. I repeat that, pink drill bits. I mean, aren't there any regulations or guidelines in place that regulate which companies can just slap a pink label on their products?
No, anyone can put a pink ribbon on anything, and they do. And so we have seen pink ribbon handguns, pink ribbon porta potties, pink ribbon toilet paper, from Save the Tatas t-shirts to I Heart Boobies handbags. Pink ribbons are on everything.
That is amazing.
It was from the
yeah, go on.
From the very beginning, the pink ribbon was actually a corporate marketing tool. Few people realized that the original breast cancer ribbon was started by a grassroots activist, Charlotte Haley. She had a salmon-colored ribbon, and she put it on postcards to the NCI, the National Cancer Institute, asking them to put more than 5% of their research funding into prevention, into understanding the root causes of cancer. And Self Magazine and Estee Lauder caught wind of this, and those two marketing giants thought this was a great idea. They asked her to partner up. She said, no, thank you. And so their lawyers advised them they just needed to change the color. Well, they took this ribbon to focus groups, and pink was soft and comforting and soothing and feminine and everything that breast cancer is not, and the pink ribbon was born. And so from its very beginning, pink ribbons really have been a tool of corporate marketers to sell products, nominally in the name of breast cancer, but too often those companies are really using our disease for a public relations stunt, and we have too little to show for it, despite the billions, and it is billions with a B, spent in the name of breast cancer. Still, 40,000 women die of breast cancer each and every year, and that is not acceptable.
It isn't acceptable, and it really is a shame that this billions of dollars that people actually think are going into research probably aren't. I mean, there's probably a very little amount of money, but I guess that's the thing, is there's no regulation, so how could we really track what money and funds are going into that? What's your response, though, to someone who says corporations should be responsible for partnering with medical research groups since they have a lot of money, or that criticizing Komen is counterproductive because any contribution to finding a cure is still a contribution?
Well, there's nothing stopping any company from making a charitable donation. Companies can give to nonprofits anytime they want. What we see with pink ribbon promotions is that companies aren't just giving money, they're actually trying to sell products and drive up their revenues, which they justify through some charitable contribution. And there's been a lot of coverage of the follow the money issue, how much money is really going to a breast cancer organization. Too often we see that no money is going to any breast cancer organization on these pink ribbon products. Oriental Trading, for example, is selling pink plastic bags that say, show you care, be aware. And so consumers are really paying a company for the privilege of carrying around this pink ribbon bag. And again, no money goes to any organization. As far as the question, doesn't any money for breast cancer, isn't that a good thing? It's essentially a question of, doesn't the end justify the means? And I think that when we're talking about toxic products, perfumes with known hormone disruptors, Kentucky Fried Chicken, Yoplait yogurt that was produced with dairy stimulated with the synthetic growth hormone linked to cancer, in each of these cases, encouraging consumers to buy products that contain chemicals that can put us at increased risk of the disease is incredibly hypocritical. And if companies really care about breast cancer, they will make sure that their products and services aren't putting us at increased risk of the disease.
That's the part that disgusts me the most, is seeing carcinogenic products being slapped with pink ribbons. It makes me sick. Your organization, of course, has highlighted NASCAR to Hooters whom participate in this, but you also wrote a scathing critique of the NFL in a Guardian piece titled "The NFL's Breast Cancer Scam Sells Bunk Science to Profit Off Pink Clothes." Talk about this scam specifically.
Yeah, so there's a lot of questions about pink ribbon products. And so we began with the follow the money. Isn't any money for breast cancer good? Who's really profiting from breast cancer? But what we've seen over the years is the pink ribbon is really one of the most successful marketing tools of our time. Everyone knows what a pink ribbon is. Everyone knows it stands for breast cancer. And pink ribbons have really hijacked the breast cancer movement. And so this year we came out with a sweeping critique that calls out the empty awareness, the misinformation, the profiteering, the pinkwashing, the degradation of women, and the ways that these pink ribbon campaigns obscure the harsh realities and the social injustices of the disease. So speaking of the NFL has in the past come under criticism for very small percents of the proceeds that actually go to a breast cancer organization. We are actually targeting them for their bad medical advice. So you've got a professional sports league, a male-dominated professional sports league at that, which is telling women annual screening saves lives. And much as we wish it was true, the science is very clear that screening is not saving lives. And 30 years after we've launched mass population screening, we have not seen a reduction in the death rate in breast cancer. And there's been a lot of research come out that's very clear that what makes a difference in mortality is access to high quality, evidence-based, culturally competent, affordable health care. That's what saves women's lives. Sadly, those mammograms are producing overdiagnosis and overtreatment, and they're not actually saving women's lives. And so for the NFL to kind of come into the public health sphere and offer bad medical advice to women really does a disservice. And when women are trying to make a decision about whether or not to get a mammogram, we should be making that decision looking at the evidence in consultation with healthcare providers. We shouldn't have these corporate marketing giants in the back of our mind, you know, kind of with these mantras, these catchy mantras, which are really not public health. They're corporate marketing slogans. And the reason corporations do this is because they're trying to sell products. And to do that,
Absolutely.
they manipulate our emotions and they manipulate the statistics. So they drum up fear. There's a lot of fear mongering, and they offer false promises.
Well, for now, I'm going to trust Breast Cancer Action as my go-to source for this. Thank you so much for coming on and breaking it down. This is an extremely important issue. Karuna Jagger, Executive Director, Breast Cancer Action. Appreciate it.